So, now something a bit more relevant to women, right? The unspoken word, menopause. It's so much awareness that needs to be raised for this. We want to, even for us doctors, we need to improve our understandings on how to empower women to take control of their health, especially in their most productive years. How bad is this? Oh, definition first. This is very medical. It's taken from one of my medical presentations, so spare with me. So menopause is a retrospective diagnosis. If you, in a nutshell, if you not have had menses for 12 months, you qualify. Yeah? And it tends to go around the age of 45 to 55. It's due to your ovaries saying, I'm done. And that's not the main problem. It's usually perimenopause that people suffer in silence. It's when you're leading up to menopause. It's when your body is changing. It's almost like the second puberties. You start to get skin issues, hair issues. You get grumpy, almost like PMS. I think a lot of people equate perimenopause with hot flushes, right? And that's like a 12 months to even 24 months journey. So think about it. You have 2 years that you're going through the second puberty. And not only that, now you have a lot more responsibilities. Due to menopause, standard it starts around 49 to 50. Most women reach menopause around 50 years old. And if you look at it as a life expectancy, it seems like women spend almost a third of their life going through this change, right? There's perimenopause and then postmenopause. So it's definitely something to think about even before you reach the age of menopause. So, what's that going there? Let's move it away. So how do you know you are going through menopause? Contrary to most people's belief, the hot flushes is actually not as often in the Asian population. When we watch movies, you have this very aging mom on a rom-com and she's like, oh my gosh, these kids, and then she leaves for Christmas and never comes back. That's the usual story, that's the menopause persona, but that's in the Western population more so. A recent study in Singapore showed that most Singaporeans, in fact, have very subtle signs. Muscle and joint pains were the main signs and complaints that they have, right? And it was generalized. It was not just the spine, it was not the back, it was just long zhong tia, whole body have. Yeah? And other symptoms you have are all very hard to identify. It's sleep disturbances, dryness of the body, feeling some sexual frustration, mental exhaustion, and then the hot flushes is still there, right? And the problem about this is that people don't talk about it. Women, even husbands, don't stop to think like, hey, are you having issues with this? There's a lot of like, oh, this is my own body. I'm going to just deal with it on my own. I thought I could just tahan a few more months. These are some of the real feedback that I got as we do our consultations online. We don't know where to ask for help. I don't have time to ask for help because this doesn't seem important enough. Is it? Yeah. So we found out that in Singapore, only a third or less of Singaporeans with severe symptoms actually do seek help. What happens to the other 2/3? Suffering in silence? But then there's another layer of the problem. One of the patients said, you asked, how do I know I can trust this doctor? Who do I find? And when it comes to the topic of women's health, especially menopause, actually, to be honest, it's also not very well understood in the medical community. I can go on and on around the geopolitics behind that, but focusing on us now, specialists, the ONGs, less than 50% of Singapore, this is Singapore data, okay? Singapore data. Less than 50% of ONGs in Singapore actually describe to have confidence managing hormone for menopause. And when it goes to the GPs, it's even lesser, 16%. Okay? So how are you going to find somebody that you can trust if less than half of them may not be able to help you? First, start off by identifying it yourself. Right? There are many symptoms, like I've described, like bodily changes, sexual health changes, mood. Sometimes the conversation may be more like an afterthought, like somebody telling you, oh, you're now overweight, or your belly is now bigger. That tends to happen as your hormones change. Or, oh, your bones are getting soft. These are all repercussions of poorly managed menopause journeys. You can always start by scanning this QR code, and there's an MRS, Menopause Rating Scale. It's an internationally recognized self-survey that you can use to track both your current symptoms, how likely you are going through perimenopause, and also to track after you have included some intervention. I'll give you a moment to scan that QR. Okay? Otherwise, you can search it on Google. Menopause Rating Scale. Okay. So the big question is, how do we manage menopause, right? Menopause is very much an individual journey. It's a very curated journey. It's guided very much by what you're going through, the symptoms, and the troubles that you're having. So you need to find somebody who's willing to speak to you on a personal level to some extent. This is in a nutshell how we manage menopause. Right at the top is what the doctors are very good at, which is to prescribe medications. Because when you are menopause, you're low in estrogen, the female hormone, then the obvious, which seems to, oh gosh, pardon me, then the next step to do is to replace it. So systemic medication, hormone replacement therapies as tablets or gels, okay, it can be absorbed through your skin, or you can have localized treatment on the areas. So hormonal cream down below, hormonal cream where it aches, right? That also helps. The topic of hormone is always a very touchy one. We hear stories of, she took HRT and she got cancer. And that's even a misconception amongst us doctors. And that's why so many GPs are not comfortable prescribing this medication. So staying up to date with the latest news is important. And the latest I can share is that there are a lot of potential of not causing serious harm when you use hormone medications. So you can always speak to a trusted professional on that. But in any case, if you're really uncomfortable with hormone treatment, there are non-hormonal treatments, and this tends to help a lot more for the muscle aches and the hot flushes. And also supportive treatment, because estrogen and also testosterone, which is produced by your ovaries, contribute to a lot of well-being. So energy levels, muscle tone, recovery, weight, diabetes, bones, the list goes on. And so providing treatment for those also can be helpful. And all this here sounds like a specialist thing, right? It's like, oh, you need to go to check into a major hospital to speak to your doctors about it. But to be honest, a lot of this can be spoken even online, or the resources can be even found on trusted websites. So, how is digital health going to help women going through this journey? The management of menopause is, as mentioned, a unique one to each individual. Being able to follow up with your specialist or the trusted doctor on a regular basis allows for close collaborations and build a good rapport so that you're comfortable to share the ups and downs of your journey. Having a close and safe space is so important. You need to feel comfortable with where you are, and to be honest, there's no place more comfortable than in your own room with a phone. All right? So technology can make healthcare accessible and respectful. You need to find the right one that is willing to not compromise on the quality of care. So that's all for my talk today. Thank you everyone for taking the time this evening. So this is my profile. As mentioned, we run Sire and Dame for men's health and women's health. And our motto goes is, if you can't speak to your GP about it, you speak to us. Thank you very much for your time today.